Hey there, we're going to be talking about how to choose a health plan, and this is going to be Animal Kingdom style. So, the very first thing you want to look at is premiums. So, premiums are like mosquitoes. Mosquitoes are always around, they're super annoying, and they're everywhere you go. So, every month you're going to be paying a premium. So, if you decide that you want to have a low premium every month, then you'll end up paying more when you actually do get sick. But if you decide to have a higher premium, you're going to pay less when you use the healthcare system. So it's all a matter of, do you want to spread the payments out, or would you rather wait to see if you actually get sick? So there are people who know that they definitely have to see doctors and specialists. They might know they have a surgery coming up this year, or they have prescriptions. In that case, they might want to have a high premium and pay lower into the system later on, knowing that they're definitely going to use the system, so it's a way to spread it out throughout the year. But if you don't anticipate getting sick, you hardly ever get sick, you don't have any prescriptions, you might want to consider lower premiums. Just know if you do get sick, you will have to pay more later. So that's what a premium does. They're annoying, like mosquitoes. The next thing you want to look at, copays. Copays are often by themselves, like the honey badger. They're kind of like in their own separate category. Usually, that's something you want to look at. So, a copay usually is under your primary care doctor visits, your specialist visits, but sometimes if you have like the lower premium plans, there'll be no copays. So we can talk about that later, what that means. But you want to take a look at your copays. If you know you have to see 7 specialists, you probably don't want to get a plan where you're paying $100 copay every time you see a specialist. So these copays are like the honey badger, where they're always by themselves, and they're kind of separate from everything else. The honey badger never gets full. It just keeps eating and eating and eating and eating. So there's no cap for a lot of plans on copays. We'll come back to this. Next up is your deductible. Your deductible is like the gray wolf. It's at the top of the food chain. It's going to eat first. So if you say you get sick and you break your ankle and you go to the ER, you might have a copay that's completely separate from any other benefit. And then you might need to get x-rays. So before your health plan will pay out anything at all, you have to meet your deductible. The gray wolf has to eat first. So if your deductible is $500 and you have not had any services this year, then the very first thing that will apply is the deductible. So if you choose a $500 deductible, say those x-rays and probably the first little bit of services from the ER, they are going to go towards the deductible first. If you choose to have a $6,000 deductible, just know if you do get sick, your premiums might be lower, but if you do get sick, you're going to be paying all of your deductible before the health plan kicks in anything. So you will have to pay $6,000. So if you hardly ever use the system, you might end up paying a couple $100 and the health plan doesn't pay anything at all for the year. But that's how they are set up. So you really want to think about what kind of care you get, how sick you are, or what kind of preventive care you do. So that is the deductible. The next part is coinsurance. So they're like vultures. Vultures are monogamous. They mate for life. So you're always going to have the coinsurance part of your part, which is you, and then you're going to have the health insurance part. And the health insurance is always going to pay more when it comes to coinsurance. And a lot of people get thrown off with coinsurance. It's like cost sharing. There's no insurance involved. It's not a second insurance. It just means that you are cost sharing at this point. So your deductible is met. So say that ER trip. So you have your x-ray and then say your doctor bill, and that covers the first $500. Well, anything after that will then start going into the coinsurance bucket. So your vultures are going to start eating. So a lot of times there's a percentage of split. So if there's $100 left and your health plan pays 70% after your deductible, that means that they will pay $70. This is your health insurance plan. They will pay $70 and you will pay $100. Or excuse me, you'll pay $30. So, you want to look at that as well. If you know that you're going to be using the healthcare system a lot, you might want to pay those higher premiums so you don't have to pay out 40, 50% in co-insurance when you actually use the system. So that's how these two work. You will always have co-insurance or cost sharing with your healthcare plan. And they're monogamous and they will never separate ever. Alright, so then another part of your healthcare plan is going to be your out-of-pocket maximum. And that's like a goat. The out-of-pocket maximum eats everything. So you're going to have the deductible. The goat's going to eat the deductible. The goat's going to eat all the co-insurance. And even sometimes the goat eats the co-pays. So that's something that's new-ish in the marketplace. So you want to take a look whether or not your co-pays are included into your out-of-pocket maximum. So this out-of-pocket maximum is the most that you can pay out of pocket for the entire year. Now remember, it doesn't include premiums, so you're always paying your premiums because mosquitoes are annoying and they're always there and they're always going to bite you once a month at least. So with your out-of-pocket maximum, so you have a $500 deductible and your co-insurance is $1,500. If you pay the $500 and then you keep using your plan and eventually you have bills for $1,500, altogether your out-of-pocket maximum will be $2,000 for the year. Now if there's co-pays included in that, it all will keep adding and adding and adding, and eventually the health plan will say, oh, okay, the out-of-pocket maximum, the goat, is full, and they will start paying at 100% for most procedures. So there are some that get a little tricky. Also, another thing you want to take a look at is prescription. Are prescriptions included in the GOAT category? Sometimes they are separate like copays, and sometimes they are included in your medical out-of-pocket maximum. So, you might have to watch this video a few times over in order for everything to make sense. Well, that is how a health insurance plan works, so I hope that it gets you at least started. I will be adding more videos that are more specific questions that a lot of people will have. This video would have been like half an hour long, so I'm breaking it up. So if you have any questions on this particular video, please write them down below and I will get back to you as soon as I can. And feel free to answer each other's questions if you know the answer, and make this a community where we are all helping each other. And so, yeah, thanks so much for joining me. Take a look at the other videos if you have more questions, and be in touch. Alright, well, from Awakenings Treatment in Agoura Hills, California, I hope you have a lovely day. Bye now.